Call 352-266-2859 for any questions.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 3 minutes after 10 o'clock. Thank you for tuning in. It's kind of a coincidence. We were just talking about dementia, and one of the things that the doctors in the last segment brought up was that sometimes a stroke can mimic, or the symptoms after a stroke can mimic dementia. Not that it's one and the same, and I'm not a doctor, so I shouldn't say anything more. But stroke did come up, right, in the last conversation. And we have Dr. Sallyann Coleman King speaking to us about stroke. She is a physician, a medical epidemiologist, and the director of the Coverdell Stroke Program in the Division for Heart Disease and Stroke Prevention at the Centers for Disease Control and Prevention. May, by the way, is National Stroke Awareness Month, so she's going to talk to us a little bit about it, so we know what the warning signs are, the risk factors, etc. And maybe more importantly, what do you do when you either feel you are having a stroke or somebody you love is having one? Dr. Sallyann Coleman King, good morning, doctor.
Good morning. Thanks for having me.
Thank you. Where are you right now?
I'm in Atlanta, Georgia.
All right. Well, not too far away. Yeah, I remember being in the presence of a lady who was having stroke symptoms. I was at an assisted living facility at that time, and everybody was scurrying, and they were asking her to, I think, to talk and to lift her arm. They were asking her to do certain things. Maybe we can start there. Is there anything you can tell us so that when we think somebody might be having a stroke, how can we kind of run through the checklist of things?
Absolutely. And as you probably know, a stroke occurs when blood vessels that take blood and oxygen and nutrients to our brains gets blocked or interrupted. And that can either be a blocked blood vessel, or it can be when a blood vessel breaks. So when that blood vessel gets blocked or breaks, the area of the brain that it feeds begins to die, and that's what we call a stroke. And you're exactly right. So some of those signs and symptoms are things like sudden numbness or weakness on one side of the face or the arm or leg on one side of the body, sudden confusion, difficulty talking or difficulty understanding, sudden trouble seeing in one or both of the eyes, sudden trouble walking, dizziness, loss of balance, lack of coordination, and sudden headache with no known cause. And that's a lot to remember. So when we think about assessing someone who we think may have stroke signs and symptoms, we use the word FAST in order to remember what to do. FAST, where the F stands for face. Just like you said, we ask the person to smile, and we look to see if one side of their face droops. And the A in FAST stands for arms. So we usually have the person raise both arms to see if one arm sort of drifts downward.
Oh,
or
okay.
Perhaps doesn't move.
Okay.
The other things we do are S. S is in FAST stands for speech. So we ask the person to repeat a simple phrase like Mary had a little lamb, and then we listen to see whether it sounds a little slurred or strange. And T in FAST stands for time, because as you saw the people scurrying around, they recognize that stroke is an emergency, and you have to call 911 immediately, because the life-saving treatment for a stroke occurs in the ambulance. It starts that early, where they're assessing the patient, they're making sure that they're taking the patient to the best hospital that can treat their stroke. Right. And they can often even pre-notify the hospital so that the hospital is ready and waiting for them when they arrive with a stroke patient. And this is all really important, because what we say is time is brain in this field, because every minute that your brain is not getting the oxygen and nutrients, it's dying. And that way the person gets the best chance at a good recovery.
So is there anything we do before the ambulance gets there?
Well, assessing the patient with the FAST mnemonic, using the face, arm, speech, and time is really critical, because you can tell the EMS folks a lot about where the patient is. It's also really important if you know when all of these symptoms started. We call that our last known well time. And that's really when we kind of start the clock. So there's some treatments that people can receive if they arrive earlier rather than later. And that's how we know when to start the time.
It's very sad, because younger people now seem to be candidates of stroke, whereas in years past it usually happened to the much older generation.
You're right. Risk factors for stroke are often being seen at younger ages now, and we're seeing that younger patients are being admitted for stroke and having some of these risk factors that we're familiar with. So things like high blood pressure, which is actually the biggest risk factor for stroke. But other things include things like not getting enough exercise, eating an unhealthy diet, or smoking tobacco, and all of those are important. But, one thing that we don't talk about enough probably is that your race can also impact your risk of having a stroke. We know that African Americans have double the risk of stroke compared to whites. And we also know that our genes play a role. So some of us have a family history of diabetes or have family members who have had a stroke at an early age. So we have to really get to know our family history and discuss this with our primary care provider in order to make sure we're doing everything we can to reduce our risk.
The text message we just got asked me to ask you about aspirin, and says here, is that a no-no? Is that something we shouldn't do?
We definitely recommend aspirin when appropriate. So I would consult your primary care provider because there are certain instances that aspirin can be very useful in the prevention of stroke.
Oh, okay.
But it also has risks, so it's a matter of balancing those risks and benefits.
It's a funny thing with medicines, like everyday medicines like aspirin. You always hear like one day it seems like it's good, or like one day you hear like eggs. They do the same thing with eggs, right? One day it's good.
Yeah.
How about that as far as food goes? Does that, if somebody is prone to a stroke, should they stay away from certain foods?
Well, we recommend that folks have their blood pressure under control, and that means low-sodium diets and healthy lifestyle, and that includes healthy eating. We also recommend that you keep an eye on your cholesterol because having high cholesterol puts you at a greater risk for a stroke. So, this healthy lifestyle, it includes getting good exercise, but it also includes eating healthy food and being active with your family.
How about sleep? Does that... If a person doesn't get enough sleep that's restful, could that lead to a stroke?
Well, we do think that stress could have an impact on cardiovascular risk. We haven't exactly figured out the exact risk of sleep. We do believe that having this balanced lifestyle definitely is protective for cardiovascular risk and for stroke, but I can't tell you how many hours of sleep is the best.
Can a medical checkup give the doctor information so that he or she can tell you that you better be careful because it looks like you're a good candidate for stroke? Is it always a surprise when somebody has a stroke?
No, we definitely know that having regular checkups with your primary care provider is a critical component of staying healthy. So they can look at your blood work. They can see if you have high blood pressure. They can check for diabetes. And we also know that there are some clotting disorders that can put people at a higher risk for stroke. So all of those can go to help them manage your stroke risk more effectively.
When people buy cigarettes or those vape items, is there a warning label on there that says can cause stroke?
There are warning labels on some of those, but I don't believe that stroke is specifically mentioned. But what we do know is that tobacco cessation is a critical component to reducing risk for stroke.
So a blood clot is actually one of the things that causes a stroke?
Yeah, so what can happen is a clot can form. We have little fatty deposits that develop in our arteries, and sometimes a clot that can cause a clot to form in the artery that feeds the brain.
I had somebody ask me this on the line right now. What about air travel? Does air travel sometimes cause a stroke or cause clotting, which causes a stroke?
Well, sitting for long periods of time can put you at a higher risk for forming clots in your legs. Those clots can go different places. Usually we see that increase your risk for what we call a pulmonary embolism. But
okay, so that's not the altitude. The same thing could happen on a bus.
Sure, it's about risk, and it's about being active and moving your body and making sure that you're continuing that.
Robin had Bell's palsy one day. We were sitting here, and I thought she was talking like a pirate. I thought she was being silly, and it turned out she had Bell's palsy. But at that moment, it looked like stroke. And she called. We had a nurses program we used to do, and they gave us an 800 number. So Robin called the number. Guess what they told us to do? Go to the hospital right away.
Absolutely, and that's the smartest thing to do. And that brings up something important. What we find is that, sometimes the symptoms can go away for a stroke. So someone can be actually not having Bell's palsy, but having a real stroke, and they can have the symptoms of the stroke, and then they go away. And what I want to make sure people know is that if that happens to you, do not ignore what happened. People sometimes think, oh, well, it resolved, and it probably wasn't a real stroke, and I'm fine now, let's just go on with our lives. And unfortunately, this can be what we call a transient ischemic attack, and that puts them at a very high risk of having a much bigger stroke. So it's still really important that these people seek medical care.
And how do you keep the people that are going to help the stroke person from panicking, so they, provide the best care possible? The non-medical people while they're waiting.
So I think that education provides us kind of a level of security, and I think making sure, one of the things that's important to remember is that when someone's having a stroke, one of the symptoms is confusion and difficulty talking or difficulty understanding. So quite frequently, they don't recognize what's going on. They have no idea that they're suffering from these symptoms. And so it's really even more important that we educate those around us in the community so that they recognize the signs and symptoms of stroke, and that they can use that acronym FAST and know face, arm, speech, time in order to help their fellow peers.
The nature of a very short interview like this is good in that it gives us some starting points, but obviously there's more information available. Do you have a website you can recommend?
Absolutely. Come visit us at cdc.gov/stroke. And you can learn all about stroke, and it'll remind you that stroke is an emergency and it's important to call 911.
All right, good information right there. Dr. Sallyann Coleman King, thank you, Doctor. It's been an honor.
Thank you for having me.
We will be right back.
Frogs are so hoppy, it's because they don't smoke or have COPD, otherwise they would be flip-floppy. If you want to quit smoking to prevent yourself from croaking, come to A Better You for a good acupuncture poking. Call me, Dr. Erica Olstein, with A Better You Healthcare to stop smoking today at 352-615-5566. 352-615-5566.
Hi, this is Lisa McGinnis, editor of Ocala Magazine and host of Ocala Magazine Radio. Join me every Friday at 10 a.m. when we bring the pages of Ocala Magazine to life. There's only one Ocala Magazine.
Yes, it will be, Elizabeth. You want me to patch you through?
Radio. Tune in Friday at 10 a.m. Right here on 1370 a.m. and 96.3 FM. WOCA, The Source.
This is Kenny Penny with Pretty Penny Properties. On behalf of myself, my wife Allison, and the Pretty Penny team, I want to thank you for supporting our business by allowing us to help you get your penny's worth from the local real estate market. With offices in Ocala, Spring Hill, Tampa Bay, Pretty Penny Properties helps you spend every penny wisely. Contact us at prettypennyproperties.com or call 352-629-6883. That's 352-629-6883. Thanks.
Load it, haul it, dump it, mow it.
Pro will get you equipped for anything with a John Deere 5045E utility tractor. At only $159 per month, you can add the perfect attachment to dig it, plow it, grade it, anything. Request a quote at agproco.com and get equipped for anything. Offer ends 4/30/18, subject to approved installment credit with John Deere Financial. 20% down payment required. Taxes, freight, setup, and delivery charges could increase monthly payment. See dealer for details.
Howdy folks, RL here for Dairy Queen again to tell you about what's hot and what's not. Dairy Queen has some of the best char-grilled chicken breasts on earth, as well as their chicken breast salad. And the burgers are exceptional, cooked on a real grill for the best flavor and less fat. And for dessert, blizzards are unequal. So personally, banana split is my all-time favorite. Dairy Queen Silver Springs, where we always treat you like kings and queens.
The College of Central Florida is committed to being your first choice for quality higher education. CF has locations in Marion, Citrus, and Levy counties and offers more than 60 academic programs. Earn a certificate, associate, or bachelor's degree. With Florida's 2+2 program, a student can complete an associate in arts at CF and be guaranteed admission to a state of Florida university. CF is ranked number 13 in the U.S. for affordability, is military friendly, and offers a full student life experience. Make CF your first choice. Call 352-873-5800.
Friends, countrymen, tourists, and Ocalans, lend me your ears. Hey, speaking of ears, there is an opportunity for you to help feed and provide good maintenance, housing, and medical care for Marion County's rescued big cats, bears, monkeys, and other disabled or unreleasable wild and exotic animals. Take a tour on Wednesdays or Saturdays of the Endangered Animal Rescue Sanctuary. Adults $20, children 12 and under just $12. Call 352-266-2859 for any questions.
This is an urgent health notice for all residents suffering from back, neck, knee, and wrist pain. You may qualify for a pain-relieving brace at little or no cost to you, but the deadline is fast approaching. Simply call the Health Alert Hotline now.
You heard right. You may qualify for a pain-relieving back, neck, knee, or wrist brace. These items may even be covered by Medicare or your private insurance. The Health Alert Hotline is your brace company. These specialized braces have been tested for pain relief. Call us toll-free right now to determine your eligibility and to learn how to use your private insurance or Medicare to minimize your out-of-pocket cost. Don't wait. If the deadline passes, you may lose your opportunity to get a pain-relieving back, neck, knee, or wrist brace at little or no cost to you.
800-368-6704. 800-368-6704. 800-368-6704. That's 800-368-6704.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 20 minutes after 10 o'clock. Thank you for tuning in. We are at that time of the year where the local rivers become a common place that we all want to go to. So I had a thing I used to do. I used to go down to the spot that we all know as the KP Hole on the Rainbow River, and I used to try to swim upstream to the campground when I was a kid. I wouldn't try it now. I think I'd be probably dead by the time I got done. So, but I wasn't a great swimmer. But we have a great swimmer on the phone. She is Elizabeth Beisel. I don't know if I'm pronouncing her name correctly, but she is a two-time Olympic medalist. She's the USA Swimming Foundation ambassador and the spokesperson for Swimway's National Learn to Swim Day today. Oh no, Saturday. Saturday is National Learn to Swim Day. The importance of learning how to swim by the age of 5. Good morning, Elizabeth. This is a great message. It's an honor to have you on our show.
Good morning. Thank you so much for having me.
Where are you? Where are you calling from?
I'm in New York City right now.
All right. And are you still swimming? And do you have an indoor place during the cold months?
Oh, absolutely. I think we're pretty much indoor no matter what month it is up here. But I do still swim whenever I can, try to get in the pool at least every day.
Is that right?
But it's definitely a skill that I've had my entire life that I love.
Wow. I have no idea if I swim well or not. I just move through the water. I probably do a wrong version of a dog paddle. I probably, but I love it. I just love.
The important thing is that you know how to swim.
I guess, yeah. I just love the water, and we live in an area where it's almost a part of our lifestyle.
Absolutely, especially down there in Florida. I mean, I grew up in Rhode Island, which is the ocean state, so I got into swimming when I was just 6 months old with my mom. Wow. She wanted me just to be safer around the water, so when I went to the beach or went to the pool, I would be able to have that life-saving skill of knowing how to swim. And that's really why we're here, National Learn to Swim Day on Saturday, brought to you by Swimways, and they've partnered with the USA Swimming Foundation, who I'm an ambassador for. And their mission is to save lives and build champions. And I've pretty much emulated that mission in my life by myself. I got into the water to save my life. I got into swimming because I loved it, because it was a life-saving skill, and then that turned into me becoming a champion and going to the Olympics. So, Swimways, the USA Swimming Foundation, we're urging everybody, no matter what age you are, to get into the water, especially with summer right around the corner, like you said. There is no better time for you to become more comfortable and more confident around the water.
Robin is one of those smart moms. She had her children swimming when they were very young, right?
Yeah, way before the age of 5. Yeah.
Yeah. So what that's a scary thing from like when you watch these videos of young parents putting little tiny babies in the water. But I guess is there a natural thing that we do as humans?
I think so, and I think I want it to become a more natural thing. Drowning is the leading cause of unintentional death in children ages 1 through 4, which is sort of one of the reasons why we're here today. We want to get children that have lost their lives. We want them to be comfortable and safe around the water. And there's also, aside from it being that critical life-saving skill, there have been studies that have been done that show that children that learn how to swim before the age of 5 have better motor skills, better cognitive functional skills, better mathematical skills. Statistically, they have higher IQs. So it's not just that life-saving critical sport and skill, but it's actually going to make you a smarter and more well-rounded person just because you're using your brain in a different way that you wouldn't normally use it.
It makes sense, too, doesn't it? Just yesterday we had a horrible story about a baby that was a toddler, I guess, found in a pond. And just, what it is. They walk away, and in the blink of an eye, they're in some place where they shouldn't be.
Yeah, and it's instantaneous, and that's the thing. We always need to be aware and alert, especially when we're around bodies of water. But, for parents, so one of the statistics that blew my mind is that a child that grows up in a household where his or her parents have little to no swimming ability, that child is 70% less likely to know how to swim, to have that life-saving skill of swimming. So I'm not only urging the youngsters, but the parents with children as well, to get comfortable around the water, to learn how to swim, because it is a life-saving skill that can help keep you safe and your child safe.
And how do you get the parents to stop forcing the children to get them to swim, like with a swim teacher? Because I'll see parents, moms and dads, they'll pick up their kids and they'll just throw their kids into the water, and then they start screaming and they're really scared.
Right, and you need to make it fun. There is always a fear factor of first getting into the water, especially as a young child. But Swimways has a Swim Steps Learn to Swim system that helps with babies through 5-year-old, through 10-year-old. They provide swim training devices that make it fun. They have the sticks that you can throw at the bottom of the pool, and it takes away from that fear factor, but also makes it fun while they're learning how to swim. So that's really important. And then to find a swim lesson, so to find those tools, actually, you can go to swimways.com, but to find a swim lesson provider, if you're looking to take that first step, you can visit usaswimmingfoundation.org, put in your address, put in your zip code, and it will partner you with the nearest swim lesson provider, whether that's a YMCA, a Boys and Girls Club. And you can go there, and they don't allow more than 6 children per instructor, so you can feel great about that. The instructor has eyes on everybody. It's not too big of a class, but those are 2 places that I would visit if you are really looking into taking that next step and becoming more comfortable around the water.
And you do hear about adults that have boating accidents, and then they'll fall off the boat and they'll drown because they don't know how to swim. So what are they doing on the boat in the first place?
Exactly. And, the water doesn't discriminate against any age. And I think that's such a huge message to send out, is that whether you're 5-year-old or 50 years old, you need to be safe around the water. You need to have that life-saving skills, knowing how to swim.
I just did what you suggested. I went to usaswimmingfoundation.org. I put in a zip code that's a kind of a big area here. And YMCA of Central Florida came up, as did the Central Florida Marlins. What is that?
Nice.
I don't know what that is.
Yeah.
Isn't that a baseball
It must be
team?
a local team or some lesson provider. But, yeah, super easy. It takes, 10 seconds. You just did it while I was talking.
Yeah.
And that's a great way to get started, and then going to swimways.com and getting those special swim training devices, that they range from infant to 10 years old to 20 years old, whatever it is. Those 2 places are a great way to get started.
Okay, so I just looked it up. Central Florida Marlins is at the College of Central Florida. So that's that one. And the YMCA, of course, is on the east side of town, right? Over that way?
Yes.
Yeah. All right. So how, you said you started when you were 6 months old?
6 months old, my mom had me in the water. We did the Mommy and Me classes at a local YMCA, and I was a water baby. You have the kids that are scared of the water. I loved it.
Do you have video of that?
I probably do. I have photos of it for sure. But that's the beauty of swimming. I mean, at the end of the day, it's all about having fun. And that's why I loved swimming so much. I always had fun. And, who knows, those of you listening that are just trying to get into swimming, you might become an Olympian like me one day.
Yeah.
Or it just might be a skill that you have to just be safer at the beach or safer on a boat.
How exciting was that?
It is a skill that, it was awesome. The Olympics were great. And I have a special little connection with you guys. I swam at the University of Florida, so I was up in Gainesville.
Oh, did you?
Nice.
Okay.
7 years.
And where's
I
and the pool there is in the O'Connell Center, right? Is that where the pool
Yep,
is?
the O'Connell Center. So I swam there for 7 years, lived in Gainesville, loved it. I'm back up north now, but swimming has brought me all around the world, and I got an amazing education out of it.
Where do you swim in New York City? Is there a place? I'm
not actually based in New York City. I'm based in Rhode Island.
Oh, okay.
But there are a couple pools around the city that you can get into. It's more of a low-key city with swimming, but you can always find your way.
And you don't realize how many young people that you inspire. Larry has a great nephew who's 14, and he's on the swimming team here in Marion County, and he goes all over the state to compete, and he does such a great job, and you're such a positive influence and role model.
Oh, thank you so much. I hope he sticks with it, Larry.
Yeah, I know. Well, it's everything is an inspiration. You are, he is. I think when people excel at something, it's always inspiring. And when you excel at something that can save a life, that's pretty. That's an extra bonus right there. All right, so I want to make sure we have the right websites before we have to say goodbye. The one I went to that you said was usaswimmingfoundation.org. Is there another one? Teachmetoswim.com?
TeachMeToSwim.com as well, and SwimWays.com. All three of those websites will bring you exactly the information that you need. And again, I encourage everybody out there listening right now to go to those websites and get started, because National Learn to Swim Day isn't just on Saturday, it's every day of the year.
Yeah, really. And we have rivers. Everybody loves them, but be safe. Learn how to swim. Elizabeth, what a great message. Thank you. It's an honor to have you on our show.
Thank you so much for having me.
You are welcome. We'll be right back.
Fox News Radio, I'm Chris Foster. President Trump on Twitter says if it's true, it's bigger than Watergate. Reports that the FBI had a spy interacting with his campaign before the 2016 election, investigating Russian election meddling. White House counsel Kellyanne Conway says,
as these revelations are making their way forward, it looks like the Trump campaign may in fact have been